Welcome back. This is a continuation of our chest x-ray anatomy that we've been discussing. So I've got the heart in there now. We've got the aorta, we've got the vena cava, and we've got the diaphragm in here now. I've faded out the lungs so that we can see all of those vessels I was talking about with those lung markings and that hilar region. And the way I was trying to describe that hilar region is lateral to the heart, that is more centered. Um, and I also noted that the heart, the majority of the heart is on the left side, it lies more towards the left. So all things to kind of keep it in consideration. Here's the aortic arch here, and then we can kind of turn the patient around here and see how the aortic arches posteriorly in that direction. All right. So we'll be able to see that aortic arch on our chest x-rays, and we'll be looking for that. So we talked about looking for the trachea, those apices of the lungs, right? And then that first rib, and then we were looking for that bifurcation, which is now happening behind the heart that we can't see, but in our x-ray we'll be able to see it, right? So we'll be looking for that aortic arch and our x-ray. Notice I'm kind of, fluffing over the vena cava because in all honesty, we don't look for that in our x-rays. We, as x-ray techs, are supposed to look for specific parts on that x-ray to know that the part is penetrated all the way through from the front to the back and that we've given the doctor all of the information they need to do their job. So we look for trachea, we look for the bifurcation of the trachea, we look for the apices, we look for the aortic arch, which is right here, and of course the heart shadow. And then also we look for that spine. Remember, the heart is a very thick muscle. We have to know that we penetrated through that heart. The way that we can identify that we penetrated through the heart is to see what's behind the heart. What's all the way behind in the back of our body. If we're doing an AP chest x-ray from front to back, to know that we passed through the heart and everything, is that we can see the shadow of the spine through the heart, which we can't even see. I think this says muscle on it, but the spine that's right on the other side of this muscle that's actually posterior to the spine, right? So we'll be able to see the spine, the bony structures of the spine, a shadow of it through the heart, and that way we know that we penetrate. That's a big part of chest X-ray, criteria that we're looking for. Criteria is a word that means how things are supposed to be. So when we talk about X-ray criteria, we're talking about what is supposed to be on the X-ray and how is it supposed to look. So you hear that a lot. We'll critique our images and look for criteria, what's supposed to be on the image. All right, so trachea, apices, first rib, aortic arch, the spine through the shadow of the heart, and the diaphragm. All right, and then we talked about the cardiophrenic angle or the costophrenic angle where we see the ribs lying against the diaphragm, and cardiophrenic where we see where the heart and the diaphragm sit close to each other here. All right. So that would be where the cardiophrenic. So we could say the cardiophrenic angles are more medial because they're they're near the heart. And then the costophrenic angles are near the ribs, which are more lateral on our body. All right, so that'll help you to navigate. I kind of think of the anatomy on an x-ray as a map. You can kind of think of it as navigating on a map. Is Orlando north or south of Miami? Well, Orlando is north of Miami. So is the heart superior or north the diaphragm? Yes. Is the heart inferior or south of the aortic arch? It's south, right? The majority of the heart here is south of or inferior to the aortic arch. So just try to make it make sense in some way to yourself, that'll help you, navigate through all of these structures when you're looking at them on the x-ray. All right, so as you can see, the diaphragm is a big, thick muscle, so it's really white on our image. So it's very easy to identify because we have the lungs here. That little blue shaded area here is the lung, part of the lung, right? So we'll be looking for, where the lungs meet the diaphragm. And we'll call that the costophrenic angles laterally. But we'll have to make sure that we don't clip those little angles out there laterally because if we don't see those little costophrenic angles, is what we call them, really it's just the bottom of the lungs, at the base of the lung. Um, we're looking for that to make sure that we included the whole lung in our x-ray. If we can't see the costophrenic angles, that means we probably clipped the lungs, and now we have to go do another x-ray to give the doctor the full lung in the x-ray. So that's why we look for diaphragm. That helps us to identify that we included the whole lung. You see how the lung sits pretty low there, right? Um, and then that's not even the back of this is the most posterior part of the lung here, right? The most posterior and inferior portion of the lung here that we'll actually be able to see superimposed all the way through towards the front, because we'll be looking at the x-ray as if it's one pancaked picture, right? So we'll be able to see this posterior part of the lung. It'll look like it's in the same place as the anterior part of the lung, right? So keep that in mind too. Our lungs are not just one big sac. They are, separated into lobes. So you can highlight, you really need to get yourself a 3D anatomy app. It's very helpful, but because you can see how this lobe, the lobe of the lung here, this right inferior lobe, goes pretty high. It reaches all the way up superiorly here, but it's more posterior than the middle lobe, which is more anterior here. See how they overlie each other? They overlap one another, right? So that means they're going to superimpose. These lobes will be superimposing one another in our x-rays, in our chest x-rays. So, it could look really white and cloudy, in a portion of the lung, but in order to identify exactly what lobe of the lung that, that cloudiness is in, right? Wherever maybe there may be some fluid or something in this portion of the lung, right? And the superior lobe, but it's just close enough to where they're not sure if it's in a portion of the right inferior lobe, or say the superior lobe, because they overlie one another. So that's why we always have to do an AP or a PA that's like straight on looking at the patient, like we're just standing there talking to them. And then we also have to do a lateral so that they can see, once again, those structures from front to back, from anterior to posterior, and then they'll be able to identify where something is, anteriorly to posteriorly. If we just give them one x-ray like this, then these overlying, they could have a mass. Say they have a mass in their lung here, right? Well, there's no way for them to identify exactly what lobe that mass is in, because these lobes overlie one another, anteriorly, posteriorly. So what we got to do? Turn them sideways and take an x-ray that way. Now they'll be able to see, oh, the mass is here. It's definitely in the middle lobe here. That's where it is, right? So, that's one of our x-ray, our rules that we always give in, two images, 90 degrees from each other, so that they can identify where things are from medial to lateral on our APs and PAs, and then from anterior to posterior on our lateral x-rays, anterior to posterior structures. All right. Okay, so I think that covers everything that we're, all those main things that we'll be looking for in our chest x-rays. Now remember, I mentioned that each x-ray shows these structures in a very specific way. So we're going to get very much more specific as to how these structures need to look in relation to one another and in relation to the positioning of the body part. So not only knowing the anatomy and where it sits in the body, but then we're going to go even further in depth and talking about how those structures look when the body's turned like this. How do the structures look when the body's turned like this? How does it look if we put an angle on the tube? Right? So it's going to get very in depth about the anatomy. So if we don't know that the heart is in front of that the heart is more anterior than the aortic arch, when we start talking about angulations and what's getting, projected where, it's going to get very confusing if you don't know what structures are more anterior, what structures are more posterior, what structures are more medial, and what structures are more lateral. All right, so trachea, apices, first rib, second rib, down here, the base of the lungs here, diaphragm, costophrenic angles here, costophrenic angles down by the ribs, cardiophrenic angles here by the heart, hilar region, these great vessels in here where they're entering and exiting the lungs, all right, the pulmonary trunk, aortic arch we'll be looking for, and the heart shadow. And remember, we'll be seeing that spine, the shadow of that spine through the heart to know that we used enough KVP to pass all the way through the patient. Thanks for watching.